Southwestern Indiana is now ground zero in the fight to fend off the invisible enemy. It's been 7 months since the coronavirus first entered our Hoosier communities, and while the majority of the state has managed to minimize case counts this fall, 7 of our 10 counties here in the area are in at least an orange warning level. Joining me now is Indiana Governor Eric Holcomb. Governor, thank you for taking the time to speak with us. Our extreme increase in cases and even COVID-19 related deaths comes as the state sits in stage 5, that final stage of the Back on Track plan. You're just a few days away from readdressing that timeline. Should we be walking back restrictions as we look ahead to the holidays? And is it responsible to continue operating at this level given the state of Southern Indiana?
Yes, well, Jessica, it's good to be back with you. We were last together in person. Now we're together via Zoom 7 months later. And you're right, we're in stage 5. And you know, you could call it the final stage. It's not really. It's stage 5. To be in a final stage, you would be in no stage whatsoever. This still, the stage that we're in obviously has capacity restrictions, has approval steps that you need to get from your local health department. And yes, as you rightly point out, District 10, our health districts around the state, District 10, like, you know, a district as far away as you can be from Evansville, Indiana, and still be in the state of Indiana, up in St. Joe and Elkhart County in that region, they're also having heightened cases. And what this tells me is our actions have consequences, or our inactions have consequences. And we see through our beefed up testing how far we've come since we were last together. We've seen through our beef up testing and tracing efforts and hear anecdotally about where these spikes are occurring, where the surges are occurring and why. And obviously we need to be able to address those surges surgically, because there are some districts, as you point out, that aren't experiencing that heightened outcome. And what we want to be able to do is encourage and assist with our local communities. Vanderbilt County, this is why we had Dr. Box, our Commissioner of the Department of Health, down in Evansville just last week. I believe Thursday she was on the ground meeting with local leaders and requesting what is it that they need, in addition to making sure they understand that we'll continue to partner with them on these type of restrictions, whether they have to do with local capacity limits, etc. And what we have learned is when you let your guard down, when you are not vigilant, when you just assume you won't get it, that's where we get bit. And that's where the odds go up. Masks work. They slow the spread. Not wearing masks, not physically distancing, not washing your hands, not practicing good hygiene, going into compact crowds, that costs not only at the extreme lives, but it also costs livelihoods. And so obviously better safe than sorry. We have proven across the state of Indiana that we can manage our way through this. We can. We've proven that, you know, we can go back to school. There are ways to go back to work safely. And what we need is our economy to be open and growing so that we can financially address all those other needs. But when they both shut down, that makes it doubly hard.
And I'm glad you mentioned that. That takes us into our next question. Indiana's unemployment rate bouncing back from that high in April when we saw more than 17% of the state's workforce sidelined. But it's still double the rate we saw we started the year with. Job development and training has been a focus throughout our tenure with you in the governor's office. What are you doing to help the state recover, and specifically Southern Indiana?
Yeah, well, it's not just us, but we are, and it's our federal partners and our local partners there on the ground, all working together in partnership. And that's, if there's a silver lining in all of us, in all of this, it's everyone has come together to say, how can we help and maximize, leverage that synergy, harness it and then leverage it, and make sure that whether it's through CARES Act dollars or PPP, you know, we had $9 billion come into the state of Indiana. Over 80,000 loans being forgiven. We have CARES Act dollars that are going into each of our different sectors that are in need and struggling. But there needs to be more. And what needs to happen is we've got to make sure our supply chains and lines are open, our businesses are operating safely. And as you absolutely spot on, we were at 3.2% unemployment rate in January, February. We rocketed up, adjusted up to 17.4, and now we're down to 6.4, exactly double where we were. We're one of the top 5 states to actually reduce that and go back to work among Florida, Texas, Ohio, pretty big states. And then there was Indiana and Tennessee. And so that has meant hundreds of thousands of people have gone back to work. But you're right. We have to make sure that everyone has that opportunity. And the state of Indiana has workforce development programs that are working to the tune of tens of thousands of Hoosiers who are getting certificates that the state will pay for and credentials to go into these jobs. Our economy, just to put this real quickly into perspective, we have brought in this year, with 2.5 months to go, about 25,000 new job commitments going throughout the whole entire state. And in 2016, we were just over 20,000. So 5,000 more jobs at an average wage of $27.65. So these are careers, not just jobs. $4.7 billion of capital investment already this year. And so the economy is still moving and provides opportunity. The trick is, and what we're doing, nextleveljobs.org, and Indiana Career Connector, you can see 109,000 open jobs, unfilled jobs, and 25,000 more coming over the next 1, 2, 3 years. And we've got to connect the people who want to upskill or want to pursue a different career or who were displaced. We got to turn those have-nots into haves. Fortunately, in Indiana, because our economy is opening and growing, we have the ability to resource Hoosiers with the skills that they need.
Governor, we're going to move on to November. Indiana is one of the few states that isn't allowing COVID-19 risk as the specific reason for voting absentee. That, combined with the long lines we saw in the first week of early voting here, may discourage some Hoosiers who feel they are at the highest risk from exercising their civic duty. What do you say to those people?
Well, I say there are 12 reasons how you could have voted via absentee ballot if you're confined to your home, if you're caring for someone that's confined, if you're away from your precinct, if you're at work all day. And there are 28 days. So you are absolutely right. And I took it as really good news that there were long lines. That means people are excited about voicing their opinions about how the direction of this state and our nation should go. That's a good thing. You have we started 28 days early. So while Election Day is on November 3rd, it's really election month. And so obviously the lines kind of ebb and flow, and you need to be able to pick if you're planning on voting early, and if you for some reason didn't plan on voting via absentee or via by mail, there are multiple opportunities to vote. We proved coming out of our sheltering in place or our hunkering down during a primary that elections are safe to vote in person. The PPE is on the grounds. The Secretary of State, Connie Lawson, has provided the polling sites with all that personal protective equipment and gear. It's safe to vote in person, whether it's on Election Day or the 28 days prior.
Governor Holcomb, thank you so much for taking the time to join us here. Anything else you'd like to add before we go?
Just a big thank you. I mean, there are, as tough as this is and is going to continue to be on so many, there are silver linings in this all. And when you have beautiful days like we had in southwestern Indiana this past weekend, and families are able to spend it together and breathe the fresh air, do it responsibly. I love seeing that. I love seeing people outside looking at the leaves change colors and the seasons change. But we got to do it responsibly because some people aren't able to experience that joy. And we've got to do it not just for ourselves, but for everyone else. So practice mask up, it keeps us open. It allows us to care for those who are hurting and in need right now. And we're all in this together. And the more that we are all vigilant, the swifter and safer we'll all get through this together.